is my video for NG tube. So, of course, when you start off, you always want to check your order against the MAR, making sure that everything matches up. You want to go ahead and gather your supplies. So, for this, I have gloves, I have my syringe, I have sterile water, I have cups to put my medication in, and then also my medication. With this, you also want to go ahead and grab a pill crusher if you have one. Of course, you would at a hospital, and litmus paper, which I obviously don't have either. But so you gather your supplies, and then you'd go into the patient's room. You would introduce yourself as the nurse and explain that you are going to give medications through that NG tube. And then you would go ahead and check 2 patient identifiers. So ask the patient verbally what their name and date of birth is, while also checking their wristband and making sure that that matches up. At this point, you want to go ahead and perform hand hygiene while also gloving up. The first thing before you administer any medications through an NG tube is checking the placement of the NG tube. So the placement can be checked through an x-ray, through measuring the length of the tube, and also through aspirating the contents in the tube. So we are going to do the one of aspirating it because it's the one that's most commonly used, especially in hospitals. So when you aspirate about 5 to 10 milliliters. And you just pull it out when you connect your syringe in, and it should be like tan, green, off-white. Those are super normal colors. And you want to go ahead and use the litmus paper to check the acidity level of it. So if you put the contents into here and you test it, it should come out pink, saying that it is acidic. You also want to check the pH levels of all of these. So gastric, the pH level should be less than 5.5. For intestinal, the pH level should be greater than 7. And for airway, the pH should be 6 or greater. So if any of the patient's if any of the patient's pH levels are off, you want to not give any medications. You're going to immediately call the provider and ask for an x-ray order. So then you want to go ahead and obviously before any medications, give the patient the medication right. So right patient, right dose, right route, right time. Right patient, right dose, right route, right time, right medication. And then the patient's right to refuse the medication. You want to go ahead and elevate the patient to about a 45-degree angle before you start giving any medications. So you would just go ahead and lift them up. My patient's not going to stay up, but you would want to go ahead and crush these. So you would put it in a little pill bag, and then you'd put it into the crusher and you would crush the medication. You would then put the medication into a little cup, and then you would put the sterile water inside the cup. Now, if you have like a capsule, you don't have to crush it. You can just open it up and put it into the cup. You never, ever, ever mix the medication. So if you have one medication, you put it in here. If you have another medication, you put it in here. They each get their own cup, their own sterile water. Don't ever mix them. So then you could start administering medication. So you would go ahead and connect your syringe to the NG tube. You would want to go ahead and flush it first. So you're always going to flush the NG tube with 30 milliliters of water before giving any medications. Then you would go ahead, once you flush it with that 30 milliliters of water, you're going to go ahead and pour the first medication in. Once the medication goes down, you are going to flush it again with 5 to 10 milliliters of water. And then once that goes down, you would go ahead and give the next medication. You keep doing that process over and over for each medication. Once they're done with all of their medications, you're going to go ahead and flush the tube for the last time, and it's going to be about 30 milliliters of water. So you would flush it for the last time. So the patient is supposed to be up in a 45-degree angle. The last thing that you want to do is tell the patient to stay upright for 1 hour. After that 1 hour, they can go ahead and lay down, but they have to stay upright for at least 1 hour in case of any aspirations. And then you would just go ahead and take your supplies, throw away everything, perform hand hygiene, and leave the room, and then obviously come back and check your patient.